Well, medical marijuana patients will soon have more information about the edible cannabis products available to them. The move by the Oklahoma Board of Health is welcomed by people in the industry who want to deliver safe and effective products to their clients.
After weeks of study and crafting by the Food Safety Standards Board, the Oklahoma State Board of Health considered and approved new rules for testing and labeling of edible medical marijuana products. The regulations will impact how cannabis processors perform their work.
This section would set forth food safety standards that processors must comply with in the preparation, production, manufacturing, processing, handling, packaging, and labeling of edible marijuana products.
The Board of Health has been hesitant to adopt new regulations since the Oklahoma Attorney General determined it had overstepped its authority earlier this summer when it adopted rules more restricted than the law allowed. The board reversed course and adopted a compliant set of regulations. State Question 788 did give it the power to create rules over food through the framework of the Food Safety Standards Board.
The Oklahoma State Department of Health was required to create this Food Safety Standards Board. They were also required to make available, within 60 days of the passage of the state question, a set of standards that licensed processors would use in the preparation of edible medical marijuana products.
The Board of Health felt it could only move on the food safety issues and not wider testing and standards, as suggested by the Joint Legislative Medical Marijuana Working Group. It was following the recent advice issued by the Attorney General's office,
stating that he believes that the recommendations are still outside the scope of the board, the full testing, and the current statute just speaks to clearly the processors.
Setting the final testing standards will still be left up to lawmakers.
Also, with the legislature going into session, it is more expedited for the testing to go into effect if the legislature takes it up.
By deciding to go this route, the Board of Health hopes to avoid further litigation over its rulemaking. The new edible standards will help dispensaries make sure they're giving their patients the best medicine possible.
Is that our processors are going to have to be held accountable to us when we sell these products to our patients. So all of the processors are now going to have to test their oil at least quarterly, the same oil that's going into the edibles, the cartridges, and everything else, to make sure that there's no pesticides, heavy metals, funguses, or anything else that could cause harm to patients.
The rules help patients understand what they're getting.
Expect packaging to reflect the results of the test. Expect the packaging that they're buying in the stores that have the medical marijuana goods in them to contain more information about how they were made, what's in them, the test results, the THC and CBD content. Expect there to be more readily available information.
State Question 788 also allows patients to use cannabis in several ways, including by putting it into their meals, just like Green and Clean Gourmet Cooking Executive Chef Tony Freitas has done.
I've gone through a lot of research and experimentation to figure out how to cook with cannabis and how to make it flavorful, how to make it nutritious, but also how to make it so you're not drooling on the table at the end of a meal.
Freitas learned how to cook with cannabis because he was facing health issues of his own a few years ago.
Actually, one of Oklahoma's medical refugees that had to go to California to get my medical card. I was facing back surgery, chronic pain, a lot of inflammation.
He encourages people to learn how to cook with cannabis.
I actually teach people how to cook at home. I teach them how to avoid some of the errors that I've made through the years. But the reality is, I believe cannabis should be infused in all of our cooking, whether that's just a hemp product or a low CBD product, or some people do need higher doses of THC. But this is something people can do at home. They can learn how to do it. They can learn how to incorporate it in what they're already doing in the kitchen.
The testing of edible products will help Freitas with his infused cooking as well.
As far as the lab testing, I'm very excited. I just got my first oil tested. This is my first opportunity now with the passing of 788 where we can start testing. So that brings in a whole different dimension to what I do in the kitchen, because it's always been trial and error before with no lab results.
The cannabis chef also believes that State Question 788 allows patients to take more control over their care.
It's definitely patient empowering, and I also believe it's completely innovative compared to other states' medical marijuana policies. There's several things that are both friendly for the patient and friendly for the cannabis community as we grow from a business aspect. So I actually believe Oklahoma is going to play a huge role in putting ourselves on the map within the therapeutic side of the cannabis industry.
Governor Fallin is now reviewing the rules before she signs them to put them into effect. The legislature is expected to take up more comprehensive testing standards and labeling of all cannabis products during the next session.